So today we're doing staff Botox on our beautiful nurse Nancy. So what would you like to have done today?
I want to have my forehead done because I have a lot of movement. I'm going to have her do my glabella just so I get a little bit of a lift with it.
Frown.
And then my crow's feet, which are probably my least favorite thing. And my bunny lines right in here. And my chin to help with that. A couple. I don't know if I'm doing it. But yes, just to kind of smooth everything out. Makes the makeup go on so much nicer. And
Great. And our master injector Erin is going to be doing the treatment today.
Hello. So we're going to, as Nancy said, smooth her whole face out. We're going to Botox in all the appropriate areas for her. I'm just going to place a little ice here first to help with her comfort and hopefully minimize bruising. There's always a chance of a bruise with any injectable, but if we can minimize it, we like to do that. And we also ask our patients to avoid aspirin, Advil, Aleve, and fish oil if they can prior to any injections to also help minimize the chance of bruising. All right, you'll feel a few pinches, Nancy. And you can see I've already marked where the muscle movement takes place so that we can just place Botox in enough spots around this muscle. The muscle around the eye is a circular muscle, so we just have to inject it in enough spots to inhibit that forceful motion that causes the creasing of the skin.
And because your technique is so gentle, you didn't even use numbing cream, correct?
I didn't. But we can if the patient wants it. We're always happy to numb. Happy patients and good outcomes. Those are the things we are looking for here at our office. Okay. Nice and still. One thing that we do here that I've noticed that some patients that may come from other places, we make sure to go all the way around the eye if it's indicated, all the way to the mid-pupil.
And why is that?
Because if you don't go far enough around the muscle around the eye, you can find that some buckling may take place right underneath the eye, and it may look unnatural or even kind of worse.
Yeah, it makes your makeup go on rough.
So we want to make sure to keep a good, nice, smooth eye all the way around. Tiny pinch.
How did that feel, Nancy?
I can hardly feel it.
I've been practicing.
It's like a Texas mosquito bite, right?
It is, yes, like a Texas mosquito bite.
Well, Erin is the most gentle here. We call her our Disney nurse. So sweet.
I don't know. Nancy's done my injections and she's pretty gentle too.
I know, yeah, when you did my fillers, it didn't hurt.
Yeah, she's really good.
We do try to be gentle.
We do. Some good eyes for that. Now we'll do her right eye. And we place it at the tail of the brow to also give a little bit of a lift. Looks really nice and natural. And lots of people know this, but when you're injecting Botox around the eye, you really don't have to go very deep. You kind of do it nice and superficial because the muscle is thin and the skin is thin, so.
And it also prevents risk of bruising too.
Exactly. Doing great, Nancy.
Nancy, how many years have you been getting Botox?
I had my first Botox when I was 38. And I just turned 53.
That's why your skin looks tight.
Mm-hmm. So I see before this.
Oh, okay.
You definitely don't look 53.
Oh, thank you.
Amazing.
I just announced that to the
Preventive
world.
and corrective, right? We
That's
know.
right. Absolutely.
And why is it preventative, Erin?
Well, if we can keep those muscles from the repetitive creasing of the skin, then the skin doesn't get damaged over time, and we're preventing those lines from ever getting really deep. If you look at the skin of someone who's perhaps in their 60s and they've never had Botox, you'll find that the skin has been creased repetitively over so many years that it's really difficult to truly eradicate those lines completely.
So
we can
doesn't
soften
it-
them. It's still fine to get Botox in your 60s if
Right.
you've never had it, but if you are able to be preventive and start more in your late 30s, early 40s, 50s, the sooner you get it, the better.
And
for
doesn't
sure.
it just break down the connective tissue over time if it's that constant folding and
Yes,
and it breaks
exactly.
down the
It's
collagen?
damaged. The
Right.
skin is getting damaged by that repetitive frown, by the repetitive forceful lift of the forehead, by tight smiling, you know, or
Right.
squinting. So when we can get some Botox in there and stop that damage to the skin, it's preventing.
Keeps the brow higher longer.
Exactly. We like to keep that surgeon's hand away as long as possible, right? And now these are the muscles that cause those 11s that some people get between their brows, and so we put Botox in here to stop that depression of the brow.
Now we won't know when she's mad at us. She can't frown at us anymore.
There is a method to my madness. Or to this.
Frown really hard, squint, and relax. I'm going to place a little Botox in her nose.
Eyes first.
Yeah, some patients tend to smile with their nose, causing little bunny lines.
Mm-hmm. And if you get Botox and everything is still on your face and your eyes are nice and smooth, but then your nose is wrinkling, it looks unnatural.
Right.
Mm-hmm.
And also people that have lighter eyes tend to squint more, and they may squint with their nose, so we put a
Didn't
little
know
Botox in there. Yes. Kind of, they're more sensitive to the sun. I bet your eyes are really sensitive, right, Dana?
They are.
Yeah.
So how soon does this take effect?
So most people will notice an inhibition of those muscles in 2 to 3 days, and then we see the full effect by the 14th day. So especially for new patients, we always schedule a 2-week follow-up after their first series of injections so that we can evaluate everything, make sure it's perfect, make sure that we placed enough Botox. We like to be conservative. We have been studying the muscles of the face for a long time, so we have a pretty good algorithm of what's appropriate, but we always want to do the best for every patient, and everybody's face is different. So everyone sometimes requires a little bit of a different amount of Botox. So we want to always see you in 2 weeks and make sure that we did a perfect treatment for you, and we can do any corrections at that time. So now we're going to place it in her forehead. Raise your eyebrows really high, Nancy. Good, and relax.
So Nancy, what hurts worse, this or a Texas mosquito bite?
Texas mosquito bite.
That's a compliment. Really high one more time. Relax. Really high. Relax. She gets this little, I call it her easy button. She just gets a little depression right there, so we make sure we get that. And then these little sides.
It prevents spot eye.
Right, we don't want her to have a pointy brow.
Some people like it, some people hate it.
Right, it's personal preference.
Absolutely.
I like a lift, but I like them to be a little bit more naturally arched than pointy for my own.
I do too. Same here.
Now, what we're going to do is some lower face Botox for Nancy. There's a muscle here, the depressor angular oris muscle. Can you frown, turn your mouth like you're sad? Look at me. More like this. So this muscle pulls the corners of the mouth down. So if we place some Botox in here, it'll lift the corners back up so that she has a naturally pleasant resting face, a little natural smile to the lower mouth. And then she mentioned a cobblestoning, or some people will call it the orange peel of the chin. So we place Botox in this mentalis muscle to keep her chin nice and smooth. Sometimes we don't realize it, but we'll clench our chin just kind of involuntarily. So if you put Botox in there.
It also helps with grinding of the teeth.
Yes.
Yes.
So,
Which I do.
Well, great.
I think you did very well. We
Thank
only have
you.
one little bit of blood up there, but otherwise I don't think.
So the bones go away in about 5 minutes, 5 to 10 minutes?
5 to 10 minutes. Sometimes I'll give the patient ice if they have to hurry back to their office, and by the time they get back to their office, they're all gone.
So it's our little secret.
Exactly.
That's right.
Thanks for listening.
Thank you.